What is vascular dementia? Vascular dementia is a condition that is caused by a stroke. It disrupts the blood flow to the brain. This leads to problems with memory, reasoning, ability to plan, and even behaviors. Vascular dementia is the second most common dementia diagnosis after Alzheimer's disease and can occur alone or alongside another form of dementia. What causes vascular dementia? Vascular dementia can develop after a stroke blocks an artery in the brain. It's important to note strokes don't always cause vascular dementia. The region of the brain where the stroke occurs affects your thinking and reasoning, and it depends on your stroke severity and location. Vascular dementia can also result from other medical conditions that have damaged blood vessels. This causes reduced circulation to the brain, depriving your brain of vital oxygen and nutrients. There are several factors that increase your risk of heart disease and stroke. These include diabetes, high blood pressure, high cholesterol, and smoking. All of these raise your risk for vascular dementia. The good news is lifestyle changes can help control or prevent these factors and can help lower your chances of even developing vascular dementia. I do want to make you aware that researchers have found that the brains of people with vascular dementia often show evidence of prior strokes. They have observed a thickening of the blood vessel walls and a thinning of white matter. That is the brain's connecting wires that relay messages between regions. They're also known as neural pathways. So again, I want to reiterate that a person that has suffered a stroke does not mean that they'll develop a form of dementia. Other factors depend on the size and the number of strokes, as well as the region of the brain where the stroke occurred. It's important to note here that the vascular dementia can also result from other conditions that impede blood flow and delivery of oxygen to the brain, such as narrowing of the arteries. This could be caused by high blood pressure, problems with irregular heart rhythms, and diabetes, and high cholesterol. By controlling or managing risk factors, you may lower your chance of developing cognitive impairment and dementia. So what are the symptoms of vascular dementia? Symptoms of vascular dementia will vary depending on the part of the brain that your blood flow is impaired. Of course, the signs and symptoms of vascular dementia may overlap with those of other types of dementia, which is the most common type that occurs with vascular dementia is Alzheimer's disease dementia. Unlike Alzheimer's, the most significant signs and symptoms of vascular dementia tends to involve the speed of thinking and problem solving that is occurring rather than memory loss. The signs and symptoms of vascular dementia may appear suddenly or may progress slowly over time. People with vascular dementia may experience confusion, trouble paying attention and concentrating, reduced ability to organize thoughts or actions, difficulty performing tasks that used to be easy, such as paying bills or grocery shopping, declining ability to analyze the situation, develop an effective plan, and communicate that plan to others. This could simply be planning dinner. They want to make a grocery list, go to the shop, go to the store to get what they need, cook it, and then tell everybody what time to be there for dinner. It sounds like a lot when you say decline in ability to analyze a situation or develop an effective plan. It's just figuring out step by steps how to do something and communicate it to others. People with vascular dementia have slowed thinking. They have difficulty with organization, trouble following instructions, or learning new information and routines. They have a difficulty deciding what to do next. Of course, problems with memory can be forgetting current or past events, misplacing items, getting lost in unfamiliar routes, restlessness, agitation. Some may suffer an unsteady gait. Some may have sudden or frequent urge to urinate or have the inability to control passing urine. They become incontinent. They have problems with language, such as finding the right word or using the wrong word. Or sometimes I call it word salad, where they mismatch words together and they do it in such a way that it passes right over you. They don't realize that they're doing it. There's definitely just changes in sleep patterns with the vascular dementia, difficulty reading and writing, loss of interest in things or people, changes in personality, behavior, mood, such as depression, agitation, and anger can occur. Hallucinations or delusions, believing that something is real that is not, and poor judgment and loss of ability to perceive danger. The symptoms of vascular dementia may be most clear-cut when they occur suddenly following a stroke. When changes in your thinking and reasoning seem clearly linked to a stroke, this condition is sometimes called post-stroke dementia. Sometimes a pattern of vascular dementia symptoms following a series of strokes or mini strokes occurs. Many strokes are also known as TIAs or trans-ischemic attacks. Changes in your thought process occur in noticeable steps in a downward spiral from the previous level of function, unlike the gradual, steady decline that occurs in Alzheimer's dementia. However, vascular dementia can also develop over time, gradually. I want to give you an example of the TIAs and a gradual decline versus the downward spiral. I have a client, let's call her Charlotte. She was in her late 70s and she lived alone. She was fiercely independent. She was a cat lady too. She had 5 or 6 cats, lived out in the country. Charlotte had several mini strokes over a 10-year period. When she realized something was not right, she would call the first responders to her home. By the time they got there, she would have already recovered. Even her vital signs were stable, although there were many times her blood pressure was higher than it should have been. Charlotte's doctor monitored her. She had high blood pressure and was a very non-compliant diabetic. Oh boy, was she a character. I spent time with Charlotte over a period of 10 years. She drove a big, bright red F-150 truck. And she would go out to eat about 2 or 3 times. Her and I would go out to eat about 2 or 3 times a month. One day, after a very enjoyable lunch and grocery shopping, as she was driving, Charlotte suffered a mini stroke. It was very transient. We were lucky that we didn't have an accident that day. We were also lucky she was close to home and I was able to get into the driver's seat and I drove her to the hospital. That was the first time the healthcare professionals actually evidenced that she suffered a mild stroke. There was concrete evidence. In the past, by the time that everybody got there, it had resolved these mini strokes. It also became apparent over the next few years that the results of multiple mini strokes were accumulating, and Charlotte was experiencing mental decline. It was very subtle at first. A year later, Charlotte had another mini stroke, and at that time, she suffered post-stroke dementia. And just a little fact, about 1/3 of stroke survivors suffer some form post-stroke dementia. The results of that stroke were the beginning of her decline. Sadly, she was admitted to a hospital and then to a nursing home. It's important to note here that vascular dementia is one of the most preventable types of dementia. I've said this in previous lessons, but it warrants being said again. The risk factors for vascular dementia are the same as those for heart disease and stroke. Risk factors for vascular dementia include increasing age. The risk of developing vascular dementia rises as you grow older. It is rare to have a stroke before the age of 65. I say rare, but although because I've been a nurse for over 50 years, I have seen very young children have multiple strokes. The risk for developing vascular dementia increases substantially when you reach the 90-year-old mark. So it's usually for older people over 65, but it does, just for your information, it does happen in some children and young people. It's very sad. Another risk factor is having a history of heart attacks, strokes, or mini strokes. Again, TIAs, transient ischemic attacks. If you've had a heart attack, you may be at increased risk of having blood vessel damage in your brain. The brain damage that occurs may increase your risk of developing dementia. Atherosclerosis, or abnormal aging of blood vessels, is also a risk factor. It predisposes to a vascular dementia. This condition occurs when the deposits of cholesterol, also called plaques, build up in the arteries and narrow the blood vessels. The atherosclerosis can increase your risk of vascular dementia by decreasing the blood flow and decrease the nourishment to the brain. High cholesterol is another factor. Elevated levels of low-density lipoprotein, called LDL, the bad cholesterol, are associated with an increased risk of vascular dementia. Of course, high blood pressure is another factor that may contribute to developing vascular dementia. When your blood pressure is too high, it puts excess stress on your blood vessels. This occurs everywhere in your body, including your brain. Diabetes is another risk factor for vascular dementia. High blood sugars damage blood vessels throughout your body. Damage in the brain's blood vessels can increase your risk of stroke and vascular dementia. Of course, smoking damages your blood vessels, increases your risk of atherosclerosis, as well as other circulatory diseases, including vascular dementia. Being overweight is a well-known risk factor for vascular diseases in general, increasing your risk for vascular dementia. I mentioned before an abnormal heart rhythm may contribute to developing vascular dementia. Atrial fibrillation is one of those conditions. This condition affects the upper chambers of your heart. They begin to beat rapidly and irregularly. It becomes out of sync with the heart's lower chambers. Atrial fibrillation increases your risk of stroke because causes blood clots to form in the heart that can break off and go to the brain's blood vessels. The good news is that preventing or decreasing the development of vascular dementia is absolutely possible. In fact, the incidence of vascular dementia is declining. And I've said this before, and I know sometimes you get tired of hearing it, but the health of your brain's blood vessels is closely linked to overall heart health. Taking those steps to keep your heart healthy may also reduce your risk of vascular dementia. Keeping your blood pressure in the normal range may help prevent both vascular dementia and Alzheimer's. Avoiding the onset of type 2 diabetes with diet and exercise is another possible way to decrease your risk of dementia. If you already have diabetes, controlling your glucose levels may help protect your brain blood vessels from damage. Hey, smoking damages blood vessels everywhere in your body. As hard as it is, you really should make every effort to stop smoking. Regular physical activity should be part of everyone's wellness plan. In addition to all of its other benefits, exercise may help you avoid vascular dementia. A healthy, low-fat diet and cholesterol-lowering medications, if you need them, may reduce your risk of strokes and heart attacks that could lead to vascular dementia, probably by reducing the amount of plaque deposits building up inside your brain's arteries. So a healthy lifestyle is important to reduce your risk factors of developing vascular dementia. This includes eating well, limiting alcohol, not smoking, exercising, and managing your stress. I'm Diane Carbo, RN with Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.